In rural sub-Saharan Africa, where the majority of people live, the benefits of family planning are literally out of reach. There is a critical shortage of doctors, nurses, and other medical personnel. Communities can be located many kilometers from a health facility. Roads are poor and the transport is scarce.
I have 7 children. Before I entered in family planning, I was very thin. I could not do any work and I could not do any development. I've taken 1 year, one and a half year in family planning. But now I'm seeing some development in my family. We are constructing a house. And even we have managed to take our children, 2 of them, they are in the boarding school.
Agnes is fortunate. Where she lives, community health workers provide family planning services. The community-based distribution of family planning, including injectable contraception, is an evidence-based way to ensure that women like Agnes can obtain family planning services where facilities are not accessible and shortages of medical personnel are most acute. Uganda, Madagascar, Malawi, Nigeria, Zambia, Kenya, and Rwanda are among the growing number of countries embracing the provision of Depo-Provera at the community level. Across West Africa, demonstration projects are being implemented. Some countries are also changing their policies. In 2011, the Uganda Ministry of Health approved a landmark policy addendum permitting community health workers to administer Depo-Provera. The practice involves community health workers who already provide family planning. These community health workers undergo specialized training to provide Depo-Provera, including classroom and practicum-based instruction supervised by medical personnel. Training topics include balanced counseling, referrals, record keeping, infection prevention, supply management, and waste disposal. Community health workers are chosen by their own communities. Once trained, local leaders formally introduce them so that the community is aware of the services they provide. Community health workers are attached to local health facilities and are regularly supervised. This helps ensure supplies are maintained and referral networks are strong. Research findings indicate that clinic staff appreciate the involvement of community health workers because it frees up time for them to focus on higher-level tasks. Community-based services do not replace clinic-based services. Rather, they are an extension of the healthcare system and can reach people who would not otherwise have access. By making injectable contraception, in addition to other contraceptive methods available at the community level, more women can access their family planning method of choice. The community-based provision of injectable contraception is no longer a radical innovation in sub-Saharan Africa. It is becoming a standard of practice. We must bring a range of family planning methods to women where they live, to the community, to the village, and into the household. By doing so, we can improve the lives of women, their children, and their communities. Become an advocate. Seek information and resources. Speak with your colleagues and learn more about your country's existing community-based distribution programs. Support the uptake of this practice by starting a task force, advocating with stakeholders, and participating in educational tours to learn from other implementers. If you are already involved, share what you have learned at the national and international meetings and connect with other implementing agencies.
What do no makusumu baba? Nitemriga nanengi go wuru. Ya kwa do katatu ngobwane. What do no makusumu baba? Wawinjo giero, wawinjo giero, wawinjo giero, wawinjo giero, wawinjo giero.